Welcome to Healthline 3. I'm Linnea Allen, and I'm joined today by Dr. Kamel Brakta, a general surgeon with Willis Knighton Health System. If you have any questions for the doctor, be sure to call the number that you will see on your screen throughout the show. That's 318-219-4569. We will be taking your questions live and free of charge. So Dr. Brakta, thank you so much for being here with us. We appreciate it.
Thank you for having me.
Okay, so we are talking about robotic surgery, right?
Correct.
So when many people think robotic surgery, they have this fear, okay, we're talking about a machine operating on me, but that's not what we're talking about, right?
So I'm actually glad you mentioned that, because I do have some patients that come to me to the office and wonder, am I the one doing the surgery, or is it this robot or the machine? And obviously I try to assure them that the machine doesn't do anything that I don't tell it to do. So the robot is a tool. Obviously it's an advanced technologically advanced tool that enables me to get the job safely and a lot more precise than otherwise would be.
Okay, so you brought a video that
Correct.
we can show, and you can kind of show people what that is, right?
Sure, absolutely.
So
let's do that.
We're going to watch this video now, and Dr. Brakta is going to tell us what we're seeing. Okay, talk us through this.
So what you're looking at right now, these are the elements of the robotic system itself. So these are the actual arms that are placed on the patient or next to the bed, and then ultimately placed on the patient through ports, through small little ports, which we'll show here in a couple of seconds. There are 4 arms that protrude through that machine, if you will. And then this is the console where the surgeon sits. Now we're back to the actual arms. And so that's the console where the surgeon sits, and those are the handheld arms that enable you to essentially control every instrument that go through those arms. Those are the instruments. These are very fine, small instruments that have essentially complete free degree of motion all around, that enables us to manipulate the tissues in a 3-dimensional fashion, compared to laparoscopy, which is just 2-dimensional.
Well, and compared to your own arms too, because unless you walk around a patient, you can't really get those angles, right?
Exactly, correct.
Okay,
So this is bringing the cart in, and you're bringing it to the bedside where the patient would be laying down, and then those are the ports that go into the abdomen, into the patient, and those are the instruments going through those small little ports, which are about 1 centimeter, which is half an inch.
So how close are you to the patient when you're using one of these?
So as the surgeon, you're sitting at the console, which is in the same room right next to the patient. And you also have an assistant at bedside that helps you put in and remove instruments depending on what you need to work with.
Okay, so I saw that the doctor was actually looking at it looked like he was looking at a screen.
Correct.
So what are you seeing on that screen?
Yeah, so once the instruments are into the abdomen, obviously before we put the instruments in, we insufflate the abdomen with CO2, the gas that helps us create the space inside the abdomen.
So you make it bigger, you blow it up.
Correct, exactly.
Okay, cool.
And then once the ports are in, the instruments then are brought in through those small little ports, and once the instruments are docked, then now I have full control, including the camera. So once the camera is on, then what I'm seeing on that on the console, essentially a 3-dimensional view of the anatomy and wherever structure that we're operating on inside the abdomen.
So is it, okay, and this is going to sound kind of strange, but is it like a video game? Are you seeing like a video game, or are you seeing the actual what's in there?
Yeah, no, you're seeing the actual anatomy, the patient's insides, if you will. But the vision is very precise, the resolution is phenomenal, and again, the camera is magnified 10 times, which allows you to, have a very, very clear vision and know exactly and precisely what you're doing, what you're cutting on, what you're removing, etc. So there's no room for error when you have that superb of a view.
So you're actually seeing better than you would see with your eyes were you looking over the patient?
Correct, because the vision is magnified 3-dimensionally, and the resolution again is,
That's fascinating.
Very good.
Okay, so tell me, all right, so I saw that the surgeon on the video was holding it looked like two different things that they were holding. So what do the instruments look like? Because I mean, normally it would be a scalpel or something similar.
Right. So these are instruments that are placed through the ports at bedside, and they're graspers, scissors, things that you work with inside the abdomen. The instruments are very small, about 1 centimeter to 2 centimeters. And at the console, I have these handheld arms that essentially control those instruments. And I can switch from one arm to the other using my feet. So the feet are also working to help you control the camera and also switch between arms, because you have 4 total arms, one for the camera, and you have 3 additional arms that allow you to use different instruments to operate.
So you're basically like a drummer. You're using your hands and you're using your feet.
In a way, yes.
Except that you're more precise than a drummer.
Correct,
with
exactly.
sticks.
And the other thing that the robot does, it also filters out any tremor completely. So if there is any tremor, it doesn't translate through those instruments. It gets filtered out completely.
So that's another safety feature.
Correct.
That's okay. It's all very fascinating. So what kinds of surgeries do you do robotically?
So really the full spectrum of general surgery. Anything that you can do intra-abdominally, you can do it through a robot, electively, of course. Anywhere from the most common things that we do as general surgeons are gallbladder disease. We do a lot of hernias, any abdominal hernias, intestinal work, whether it's small intestines, large intestines. We also do acid reflux, work on the stomach, anything in the abdomen, basically.
Okay, so talk me through some of those diseases. Let's say gallbladder disease. So what would make someone with, I mean, how does that progress to a point where you'd need to do surgery?
So, so gallbladder disease is actually one of the most common conditions that we see as general surgeons, and most of these patients usually present to their primary care physician or to the urgent care emergency room where they're having symptoms, and those symptoms can range anywhere from mild nausea, vomiting, abdominal pain, to severe pain that doesn't go away, fever. Those are a constellation of different symptoms that can result as a result of gallbladder disease. And the earlier the intervention happens, the better the outcome usually, in terms of doing robotic surgery, because it enables us to intervene before that disease process gets worse.
How does somebody know that they have it, number one, and that they need to call the doctor, number two? Usually
patients will experience abdominal pain in the upper abdomen after, usually after eating, especially eating foods that are rich in fat. Fried foods and greasy foods usually will trigger gallbladder symptoms.
But I would imagine that that's also can be confused with other things. You mentioned acid reflux.
Correct. And those symptoms can be or can overlap, and that's why whenever you have any of those symptoms, it's recommended that you go ahead and see your primary care physician, so that way they can do more tests, get labs, and figure out exactly what's going on. Okay, so what about hernia? You mentioned a hernia. So what is a hernia exactly? I know that seems like a strange question from a 50-some-odd-year-old woman to ask, but I really don't know. So a hernia is essentially a defect. There are a variety of different hernias anywhere in the body, but strictly speaking, from a general surgery perspective, and the abdominal typical hernias that we talk about are essentially defects in the abdominal wall, and you can think of the abdominal wall as layers of tissues that protect the insides, and sometimes there are weaknesses or defects in that abdominal wall, and as that pressure inside the abdomen increases, especially with activity, if you're lifting something heavy or if you're straining, then those weak points can give into that pressure, and then things can protrude, or you may notice a bulge or swelling somewhere around your abdomen, really anywhere. It could be in the groin area, it could be around the belly button, it could be through an area that you may have had surgery on in the past, because once you've had surgery, now that those tissues aren't as strong as they were before, and you can have weaknesses in those areas, which then can develop into a hernia. So how do you fix that with robotic surgery? So any hernia, obviously depending on the size, most hernias can be fixed with robotically, because we're able to put in very small little incisions through those small little ports that you've seen, and you create space between you and the target wherever the hernia is, and you put those ports in, and you can come in with a robot and then completely repair that hernia by sewing those, bringing those tissues together and getting rid of that weakness. And then in most cases, depending on the hernia size, we also add a piece of mesh, which helps, sort of like a patch that will help reinforce that weakness and strengthen that area.
Does that mesh stay there? Does it dissolve? How does that work?
So there are different kinds of meshes, and depending on the patient and their needs, you can use meshes that get absorbed over time and they incorporate into the patient's tissues, or sometimes you may have to use meshes that stay there forever. They're synthetic meshes. And a lot of patients will ask whether these meshes are safe. Nowadays, the meshes are very, very safe. The risk of them causing trouble is significantly lower than they used to be in the past.
Okay. All right. Well, I just want to remind everybody who's watching, I'm not the only one who can ask questions. You guys can call in and ask a question to the doctor free of charge, live. Just call the number on your screen. That's 318-219-4569. Okay. So what are the benefits of robotic surgery over regular surgery?
Excuse me. So when we're thinking about robotic surgery, it's an extension of laparoscopy. Laparoscopic surgery is essentially the same concept, except you don't have the flexibility that you do with the robot. You don't have a three-dimensional camera with an incredible resolution and magnification. You're limited in how much you can do laparoscopically because you're standing at the patient bedside and you're only working in a two-dimensional manner. Those instruments that you're using can only move in a two-dimensional manner. They don't allow you the ability to work three-dimensionally, where in the robot, with the robotic surgery, you have instruments that are endo-wristed, meaning they have wrists in them and they can move freely, get into small little spaces. It enables us to sew much easier than you would otherwise with the robot, with laparoscopy. I'm sorry.
Okay, and I want to come back to laparoscopy.
Sure.
Say that again.
Laparoscopic surgery.
Laparoscopic surgery. Okay. Well, we have a James on the line. So, James, do you have a question for Dr. Brakta?
Yes, I was calling. Yes, I was calling to see, do they do like surgery on rotator cuffs?
Rotator cuffs. Do you do surgery on rotator cuffs?
Unfortunately, I do not. That would be under an orthopedic surgeon. An orthopedic surgeon, they're the ones that would do a rotator cuff surgery. And my understanding is that they also have scopes and laparoscopy and ways to do it in a minimally least invasive manner.
Okay. All right.
Does that answer all your
That's
questions,
all.
James?
Yes, ma'am, it did.
All right. We thank you so much for calling. Okay, so going back to laparoscopic surgery. So explain what that is so I can understand the difference between, like, I've seen what the robotics looks like,
right?
But what is laparoscopic?
So, laparoscopic surgery, it's sort of a similar concept in the sense that you're working through those small little ports that are a centimeter or so in length, and that you're putting them into the patient abdomen. But the main difference is that you're standing at the patient's bedside during laparoscopy, and you're working with your arms and these instruments that you're inserting through those ports. But those instruments are very limited in what they can do, significantly limited compared to the robotic instruments. And again, it's all because of the technology. Technology has just come so far to the point that now you can sit at a console and work through that machine while you're manipulating all those instruments.
And so, especially since you just said with laparoscopic surgery, the surgeon is doing the operating just through smaller tools. But with the robot, I would assume that you wouldn't get tired.
Correct. That's actually one of the benefits, because instead of standing at bedside, and sometimes the laparoscopy puts you in these weird different positions that really put a lot of stress on your body, the robot gets rid of all that. You're very comfortable, you're sitting there. The machine is really enables you to be much more comfortable and get the job in a much more precise and least invasive manner. So as a result, the benefits, as you can imagine, less blood loss because you're very precise. You can see the tissues a lot better than you would otherwise. Therefore, the trauma that you're creating during that surgery is very minimal and precise, which translates to less blood loss, less pain, less scarring, because you're using very small little incisions, and all of that obviously helps the patients get up, get better faster, get back to their routine faster.
Sounds like a win-win. Well, we have another caller. Edna, are you there? And do you have a question for the doctor?
Yeah, I have a hiatus hernia, and sometimes when I move a certain way, it's like under my ribs where it feels like a big knot comes up, and it really is painful until I get it back into where it needs to be.
I'm sorry, if I may ask you again, where was the hernia?
It's up in my ribs. It's like a hiatus hernia.
Okay.
Up under her ribs.
Okay. Are you feeling a bulge in that area, or?
Yeah, it's like a bulge, like a swelling, and then up under my ribs is like when I move a certain way, it feels like something's coming out.
Right.
It's painful. It's like a big knot.
Yeah. Have you seen your primary care physician, or have you had anybody look at it?
No.
Yeah, that's what I probably would do. Is especially if this is something that's causing you discomfort and causing you pain, I would visit with your primary care physician. That way they're able to examine you and get some labs, get some tests, and probably get some imaging, an ultrasound or a CT scan that will take a look at that area and figure out what it is exactly. And then they can give you a referral to a general surgeon if need be.
Okay.
Does that answer your question,
I'll
Edna?
do it. Yes, ma'am. Thank y'all very much.
Well, thank you so much for calling. We appreciate you. Okay, so Dr. Brakta, we were talking about the benefits of robotic surgery, and so we talked about it keeps you from getting tired. You can, because it's a robot, you're not having to hold your arms up. We talked about smaller incisions, less blood loss.
Correct.
Because it's all
pain.
minimally invasive.
Correct. I mean, the benefits to the patient are enormous. Like I said, there are a lot of surgeries, different types of surgeries that are very, very difficult to do laparoscopically, and so these patients a lot of times end up getting open surgery when robotic is an option, which can obviously eliminate having bigger incisions, more pain, longer duration of recovery, and those are real benefits that robotic surgery can offer.
And it lessens recovery time in many instances.
Correct. It really does, especially in some of these complex big operations. Like acid reflux operations, colon or intestinal operations, to where you're obligated essentially to make a big incision to do the surgery. Robotically, you don't have to. You can do all those complicated surgeries. You can still do them robotically.
So how much a difference are we talking about? If I had the acid reflux surgery one way and the other and robotically, what's the difference?
So for example, if you had, let's say, colon surgery, which is one of the most common surgeries we do, if you do it open, most patients stay in the hospital a minimum of a week to 10 days. Again, because of the pain, the length of the incision, the operation itself. If you do that operation robotically, depending on what part of the colon, some of these patients can go home as early as 2 to 3 days.
Wow, that's a huge difference.
Absolutely.
Okay. All right. So do patients have a choice whether they can get robotic surgery or general surgery?
Of course. As long as the patient is informed, they can always ask their primary care physician, ask about robotic surgery, what is it, how does it differ, and yeah, the patient always has a choice.
Okay. And so if the patient was on the fence about, I don't know which one to do, what would you say to them?
For us surgeons that do this, it's a no-brainer. Of course, some patients may have some apprehensions or hesitation as to the robot, and it's again, but hopefully we've shed some light in terms of how that works and the fact that the robot doesn't do anything that we don't tell it to do as surgeons. So.
Well, and you actually manipulate the machine
Correct.
yourself.
Yeah, the machine, everything I do is manipulated by my hands. The machine and the tools are they're just tools that help me get the job in a much better fashion.
Longer arms that don't get tired.
Absolutely. Absolutely.
Okay, so are there any specific surgeries where robotics cannot be used or shouldn't be used?
So that's a very good question. In emergency situations where patients are very sick, they have what we call catastrophic illnesses intra-abdominally. In those situations, usually, and again I say usually because there are some exceptions where you can still use a robot, but by and large, if the patients are very sick and they have intra-abdominal severe illness because of what we call a perforation, or let's say a large bowel that has a hole in it opened up and the patient is very sick, in those cases usually you have to open for a variety of reasons, of course, to get the job done. So in those cases usually the robot is not or has little role, so to speak. Now there are certain exceptions, but by and large, if you're dealing with emergencies, then usually open surgery is the preferred method.
Okay. I just found out that we have another caller. Rita, can you hear us? And do you have a question for the doctor?
Yes, I do. Thank you for taking my call. I have been on like Prilosec or Metrazole for one of their generics for over 20-something years. I can't remember that maybe years back I was diagnosed maybe with a little hiatal hernia. I'm not for certain, but about 7 weeks back, I decided I would try to stop taking this medication, and I'm really dealing with heartburn and acid reflux. I take papaya tablets, I chew on those, and different, occasionally antacids. But what is the acid reflux surgery, and what do you recommend? Because I really don't want to go back on those medications if I can avoid it.
Very good question. What's your name again? I'm sorry?
Rita.
Rita. So yes, you've mentioned a lot of things there, and obviously it sounds like you've been suffering from acid reflux for a long time, and certainly surgery is an option. So when we're talking about acid reflux, the first thing I would recommend is visit with your primary care physician and ask them if they can give you a referral to a gastroenterologist, so we can do some of these tests prior to doing the surgery. And so what the gastroenterologist would do usually is do several tests to determine the acid level. They will also do a scope to look into your esophagus and the stomach, because there are sometimes what causes this acid reflux to be out of control is, like you mentioned, you said you've had a hiatal hernia, and a hiatal hernia is essentially a hernia that is inside your stomach or your abdomen, where part of your stomach is slipped into the chest. And as a result, if you have part of your stomach that has slipped into the chest and is sitting there, that acid gets up in the esophagus very easily, and that's why you're having those sensations of having heartburn and burning that comes up through your esophagus. So yes, in that case, what we do, we go in robotically and we fix that hernia. We pull that stomach back into the abdomen where it belongs, under the diaphragm. And then in addition to that, there are 2 ways that we can fix or that we can help mitigate acid reflux nowadays. You can use the conventional method where you take part of the stomach and wrap it around the lower part of the esophagus, which is called the fundoplication, which will help with the acid. Or there's also a newer method called the LINX procedure. This is an implantable device, which is made out of titanium magnet, and it's in the form of a ring that sits right at the lower part of the esophagus and helps prevent that acid from going into the esophagus from the stomach. So that's just getting into a lot of details, but I would go ahead and get started with seeing a GI doctor so they can scope you, they can do some biopsies, and then after that you can make an appointment with one of the surgeons, and they can help you from there.
Rita, does that answer your question?
Yes, I do have one more. The last newer procedure you mentioned, what's that called again?
It's called the LINX procedure, LINX. And again, it's an implantable device, and I'm happy to talk to you about all this. You just make an appointment with us and we'll be happy to explain all this to you.
Okay, I appreciate that. I actually live in Texas, so it'd be some distance for me to get with you, but thank you very much.
You're very welcome. My pleasure.
Rita, thank you for calling. Well, before we get away from that, let's go ahead, since you're saying that some people can get a referral, give your office a call. Where are you? Where are you located, and what's your phone number
I'm at
there?
Willis Knighton at the North Campus at the Medical Arts Building, and on the 3rd floor, 310, and our phone number is 318-212-6270.
And the name of the practice? Are you
Robotic and Laparoscopic Surgery.
Okay. All right, so that's where they're located, and I wanted to remind you guys that we have about 5 minutes left. If you do have a question for the doctor, call in quick at 318-219-4569. So I have a question just out of curiosity. I'm
Sure.
assuming that this is not something robotic surgery that you learn in med school. So how do you get trained to do this sort of thing?
Right. So robotic surgery has been around, especially in the general surgery arena. It has been around for about 10 years or so. Now, the system itself has been around for about 20 years, but initially it was only used by the urologists and the GYN surgeons. So general surgeons started using it around the 2008, 2009. And so unless you're in a medical school now, and only certain medical schools, not medical schools, residency programs offer robotic training. So I was lucky to have some training when I was in residency back in 2010, 2011, and 2012. Limited, albeit at the time, because it wasn't widely available. And so once I was done with my training, then I just continued to learn more about robotic surgery.
Okay. All right. Well, I just found out we have our very last caller, Anna Mae. Can you hear us, and do you have a question for the doctor?
Yes, ma'am, I can. I wanted to ask if surgery and medical procedures are the same thing, or are they different?
I'm sorry, could you repeat that again?
Is regular surgery and medical procedures different or the same thing?
Which procedure are you talking about specifically? if I may ask?
Let me spell the word for you. It's HYSTEROSCOPY.
Hysterectomy.
Hysterectomy. Yes. So.
Not a hysterectomy. No. Scope. It says scope. COPY.
It sounds like you're talking about a GYN procedure.
Yes.
Right. So, and your gynecologist would be able to help you determine whether that's a procedure that can be done. And yeah, in those those procedures are also done robotically and laparoscopically, and of course open. So if you just consult with your GYN or your primary care physician, they can refer you to one of the GYN physicians that will explain the difference and tell you whether you're a candidate or not for robotic surgery.
No. Okay, thank you very much.
Yes, ma'am. You're very welcome.
Thank you, Anna Mae, for calling. Okay, well, so we just have 2 minutes left.
Sure.
So if somebody looked at you and said, okay, is robotic surgery really safe? What do you say?
Right. Absolutely. It's very safe. Not only is it safe, in my opinion, it's better, much better than laparoscopy or, of course, conventional open surgery. Again, because of the benefits that we've listed. And I would certainly encourage patients to look into it, ask questions, find out more about it. Obviously, we're happy to see anybody and explain what robotic surgery is to any of our patients that are interested.
And one more time, what kinds of surgeries do you guys do at your particular practice? What surgeries do you do?
So as I mentioned earlier, there's a variety of different procedures that we do in general surgery, but as it relates to robotic surgery, some of the most common procedures that we do nowadays are gallbladder removal, hernias, and again, hernias that are multiple different kinds of hernias. Most of them can be repaired with robot. Intestinal removal, whether it's small, large intestines, due to a variety of illnesses and reasons. And also, of course, stomach and acid reflux is also a major procedure that's done nowadays with a robot.
And the complications are fewer?
Complications are less, absolutely, robotically. There are less, especially as it relates to infection and pain and variety of complications, but absolutely.
And quicker recovery time.
And quicker recovery, yes, ma'am.
And smaller scars, which ladies like to hear.
Exactly, absolutely.
All right, Dr. Kamel Brakta, thank you so much for
Thank
being
you.
with us.
Thanks
Again,
for
we
having me.
certainly appreciate you. And thank you for watching Healthline 3. Until next time, we ask you to stay safe, stay healthy, and have a wonderful afternoon.